I can advise that we've had 9 new cases overnight. 7 are locally acquired and linked to the Indooroopilly cluster. So that's all good news. Then we have 1 case on the Gold Coast that's under investigation. So Dr. Young will talk to you a little bit more about that in a moment. But we do have 1 new case in Cairns. Now, we are quite concerned about this. It's a taxi driver and he has been infectious in the community for about 10 days and he lives at Kanimbla. So I'll come back to that in a moment. So we have 148 active cases, 26,286 tests in the last 24 hours. So again, good testing results. And over 8,000 vaccines by Queensland Health in the past 24 hours. And Queensland Health has done now over 1 million vaccines. So that's absolutely fantastic. So look, can I just say that Queensland's done a mighty job, especially those 11 LGAs that have been in this lockdown situation. And can I thank the Deputy Premier, the Chief Health Officer, the Health Minister, the Treasurer, the Education Minister for all the hard work that's also been happening with these daily updates whilst I've been in hotel quarantine. So at the moment we have 11,177 people in home quarantine. And as we've been saying, these people are our first and last line of defence. It is absolutely crucial that if you are given a home quarantine direction order, you must follow that order. So you must stay at home. If you need supplies, we'll get the supplies to you. Now, I know it's tough. I've just done 14 days in hotel quarantine. It's a big ask, but you are keeping the community safe. So I thank you for that. Okay, so now what does that mean for the 11 LGAs? Okay, well, we've got some good news today for the 11 LGAs, and thank you for all the families, everyone who's been doing a great job. So the lockdown will end in those 11 LGAs, but some restrictions must stay in place for the next 2 weeks. So it'll end at 4 p.m. today, but we're not out of the woods. So I just want everyone to have a really good understanding that we are dealing with the Delta strain. It's highly, highly infectious. And I can tell you from my conversations in Tokyo with people from around the world, this strain is sweeping the world. So we need to make sure we are making some extra precautions, and I'll go through those with you. So for the next 14 days, one of the key areas is in relation to schools. So the schools will reopen, but we do know that with this outbreak, with the high school students, we are now going to make sure that all school staff are wearing masks, and that includes childhood staff as well. They're also going to be given priority for vaccination, so the Health Minister will go through that in a moment with you. Now, all high school students will be required to wear masks at school. Now, can I tell you, in other parts of the world, this is exactly what's happening. I know it's happening in South Australia, and from memory, I think Victoria also has done this. But for our high school students, I please need you to wear masks because you will be helping to keep the whole community safe. And this is because we've got the Delta strain, and until we can get to those 70 and 80% of vaccination rates, masks are absolutely critical. These masks are absolutely crucial because they are your protection against the Delta virus as well as getting the vaccine. Okay, so what it means for everybody else, so let me just run through this so everyone's clear. And this will be on our Facebook site, and I'm quite sure it'll also be distributed by the media as well, but we've done a roadmap, so it's going to be very clear for everyone. So you'll be able to have, this is for the 11 LGAs, up to 10 people in your homes. Okay, so that's including those who live there, and in public spaces. Now you are able to go and visit loved ones in hospital and aged care, but of course you can't do that if you are subject to a home quarantine order. Weddings and funerals, maximum 20 people. Businesses and venues, including places of worship, convention centres, retail, dining, gyms, hairdressers, beauty and personal care services, are allowed to operate with some restrictions. So we're going back to that 1 per 4 square metre rule, or 50% with ticketed and allocated seating. I have to advise that during these next 2 weeks, community sport will not be permitted. I know some people are going to find that difficult, but we have to do that to keep Queenslanders safe. Now, of course, these masks are really important, so Queenslanders, keep wearing these masks, especially in these 11 LGAs. If you are out walking by yourself or your household, you don't need to wear it, but at all other times you do need to wear it when you're in the workplace, when you're going to cafes and restaurants, except if you're seated. Now, I can tell you from experiences of what's happening overseas, if you get a big outbreak, there are perspex screens and you have to take your mask off. You can take your mask off to eat and drink and you can't speak. So this is what's happening around the world. We're not at that stage, we're at a much better stage, but it's actually going to rely on all of us to do the right thing. And I know that Queenslanders can absolutely do the right thing. Now also, if you're living in one of those 11 LGAs, please, you can travel within that LGA, but now's not the time to be travelling to regional Queensland, unless you are an essential worker. But please put off plans to visit family and friends in regional Queensland for the next 2 weeks. Okay, now I want to address the situation in Cairns. Just give me a moment. Okay. All right, so unfortunately, this discovery of a positive case in Cairns is something that we were not expecting. And we really need the residents of Cairns to come forward with any symptoms and get tested. Exactly what's been happening with the 11 LGAs. And down here, everyone has been doing a great job. Any symptoms, go and get tested. Now, this person has been infectious in the community for 10 days. That is of real concern. So from 4 p.m. today, for the next 3 days, Cairns and Yarrabah will go into a lockdown. So it's essentially the lockdown that the 11 LGAs went into, but they will be allowed to have up to 2 visitors to come and visit their homes. We need more testing in Cairns. I am very concerned. Dr. Young is very concerned. We need to get on top of this very, very quickly. The Treasurer has already spoken to me. We are going to be looking at a business support package. I'll be speaking with the Prime Minister. Hopefully he'll agree with my request to declare Cairns a hotspot. But I am very, very concerned about what's happening in Cairns. So for the next 3 days, the Cairns community, I know you can do this. I know it's going to be tough, but the next 3 days, I need you to stay at home, minimise your movements. Let's test as much as we possibly can, and then we can evaluate that over the next 3 days to see if there are any more cases out there. And of course, we'll be also working with this man's family and close contacts, and the exposure sites will be being put up. Okay, so that's the issue for Cairns and also to the 11 LGAs. Can I just say to everyone, I'm very proud of the work that everyone has done. This is incredible. I mean, when Queenslanders always do what we ask them to, and I thank you all for that. And it's because of your hard work we are in this situation today. But as we know with this Delta virus, we do expect that there will be more outbreaks into the future. So we'll be updating you as quickly as we possibly can and taking that decisive action. If you go hard and fast, and that's also been a decision of the National Cabinet, it's been my personal choice as well with Dr. Young, go hard and fast and get on top of these issues as quickly as we possibly can to minimise. I also want to reach out to New South Wales too, and what they're going through is extremely difficult, and our thoughts are with them at the moment as well, as I know that they battle to get on top of this virus. It's tough out there. It's tough. This virus is not going away. It's sweeping the world, and I just thank everyone for playing their part, and we will get through this together.